Hi, my name's Brandon with Chesapeake Men's Health. I wanted to go over my experience with getting my lab work done at LabCorp. And I wanted to also go over what the results look like so that you know what to expect when you get your lab review with me. First off, this is for educational and entertainment purposes only, not medical advice. These are my personal labs, and anybody can actually order their own labs through websites like LabCorp, and I used my connection to get them all at the same steep discount that I offer to all my patients. I want to be clear, this is not me treating myself. I cannot order medications for myself. If I want to go on any of the men's health medications that I will be describing in this or future videos, I would have to see a qualified healthcare provider to order those for me. So, how was my experience at LabCorp? Well, it's really simple. When I ordered the lab work, initially in my email, I got an email that had the subject line LabCorp order in all capitals. It's hard to miss. Sometimes that goes to the spam mail, but mine didn't. From that, it had all the instructions. So I went on Google and found the closest LabCorp, went up there, and you just go in and you put into the kiosk your phone number and click that you've already paid for your lab work. A few minutes later, you get a text message saying that they're ready. You go back. The person I was with was really nice. She let me get the blood drawn out of my hand, which is what I prefer since I like to work out a lot. And from there, everything went smooth. One stick, didn't feel a thing. It was great. Then, after about a week, I got all of my results, but oftentimes they come back sooner. So, with all of that out of the way, let's dive into what my blood work looks like, okay? And that way you know what it's going to be like for you. All right, guys, so let's start looking at my lab results. What's great about the company that I use for the labs is right at the beginning, it gives me all of the abnormal labs, makes it a really nice snapshot for me. So if we go ahead and get started, first thing is the comprehensive metabolic panel. So what I have here is glucose, and this was fasting, so that's in the normal range. Next is BUN, which is blood urea nitrogen. This is generally a marker to see how your kidney function is doing to some extent. Also hydration status. Mine's only slightly high, nothing to worry about there. Moving down, estimated glomerular filtration rate. That is another kidney function going here, which is normal, 93. So then as we keep scrolling down, sodium, potassium, chloride all looks good. Carbon dioxide's good. Calcium's looking good. Protein is looking good. Albumin and globulin look good. And this just shows that the ratio is a little different. That could be because of my diet or taking protein supplements. It might change this ratio a little bit. Next, it's bilirubin, and this is getting into your liver functions. So the bilirubin and the alkaline phos and the AST, ALT, they're all looking at liver function. Sometimes this alkaline phosphatase actually shows bone health too, because these numbers can start to elevate in older people who have osteoporosis. And then if you look at the next panel, my cholesterol panel, my total cholesterol is a little on the high side. Triglycerides are within a normal range, which is great. High density lipids are good. Very low density lipids are good. The low density lipids are a little bit high. And this is due to my diet, and this is to be expected. I mainly do a carnivore diet. At this point that I was getting labs done, I had been 2 weeks into a very strict carnivore diet, all beef basically, with black coffee and water. Moving on to the next page. So moving on to this next part here, CBC, so complete blood count with no differential. The differential refers to the type of different white blood cells that they differentiate between, and we don't really need that for our lab study. So white blood cells are good, red blood cells are good, hemoglobin looks good, hematocrit looks good, mean corpuscle volume, this is the size of the red blood cells, that's in the normal range. Mean corpuscle hemoglobin, this is looking good, so that's within the normal range. And this next one is similar to the mean corpuscle hemoglobin, but this is also looking at the color. So these two are looking at the color here. So if you have paler red blood cells and you're having a low hemoglobin hematocrit, that would indicate a certain type of anemia. If you had more red colored red blood cells, that would indicate a different style of anemia. Red cell distribution width, this tends to talk about how many new red blood cells do you have going through your system. So it's spread out how many new ones compared to the mature red blood cells. Platelets, this looks normal. TSH, thyroid stimulating hormone, mine is in the normal range, so my thyroid's good. Follicle stimulating hormone, mine is in the normal range, so that looks like it's doing well. Luteinizing hormone, 2.8, so that's in the normal range, looking good. Estradiol, that is in the normal range, looking good. DHEA sulfate, normal range. Testosterone, 539. This is actually an interesting number. I'm not really having any symptoms of low motivation, fatigue, sexual dysfunction, or anything like that. But someone who is, they would be borderline at getting onto testosterone replacement therapy. To have a really good level of testosterone, being in the 800s to 900s, low 900s, is an excellent testosterone level. But if someone was having those symptoms and they didn't necessarily want to start on testosterone, we could give them a medicine that actually helps their body to produce testosterone on its own. Now, the sex hormone binding globulin, that is normal. The testosterone free, this is the amount of free testosterone going around our systems. The total testosterone has a little bit of the binded testosterone included. So all my numbers are looking good, but if I was symptomatic, it might be a good idea to try one of the medications that would help you naturally boost your testosterone before actually starting on testosterone replacement therapy. Prostate-specific antigen, this is looking at your risk of prostate cancer. So let me scroll to the next slide. It'll continue with more about the prostate-specific antigen. So then we're getting the PSA free, and interestingly enough, what they're doing is combining the PSA free and the PSA to create this percentage here, and what that does is help to calculate your risk for prostate cancer. So let's see, mine's 32.5, so that's well above the range, plus I am not in the age range that's typical for prostate cancer. Hemoglobin A1C, this is looking at your diabetes risk, so 5.0, so that's good. So my numbers are looking great. And then my insulin-like growth factor, 139, that's within the normal range, which is good. And also, if I wanted to do something beyond testosterone replacement therapy, and say I was training for a big event, I could consider doing peptides, which are amino acid chains that stimulate your pituitary gland to release more growth hormone. So I'm at a good level where that would actually be probably a preferred therapy for me if I was trying to make some sort of gains athletically, gains in the gym or running marathons or anything like that. And those peptides are done in a 3-month cycle and tend to raise this last marker and raise the growth hormone in your system so you can recover and rebuild your tissues quicker. So anyways, this was the lab review. I hope that it kind of gave you a good insight of all the different numbers and metric that I'm going over, and also a little bit of the thought process that goes into looking through all of these labs.